There is a war. It's happening now. It will decide the fate of humanity. The time to choose sides has come. We are the resistance. We are the info war.
Welcome to the InfoWars Nightly News. I'm David Knight. It's Monday, October 13th, 2014. Here are our top stories.
Tonight, secret weapons, fake badges, and the Pentagon. Then, protective clothing fails to save the latest Ebola victim. And the Clintons' attempt to register militias like sex offenders. That's next on the InfoWars Nightly News.
Bill Clinton, admittedly, I saw the numbers a few months ago, more than half the tens of millions he raises a year with his charity goes for his fleet of private jets.
Well, of course, yesterday we learned that now we have a second Ebola patient in the United States. The first time it's been transmitted within the United States. And this was to a healthcare worker who was wearing protective clothing. She was wearing a full protective gown, gloves, and face shields as she cared for Mr. Duncan. Now, the Chief Clinical Officer, Dr. David Vargas, said this individual was following full CDC guidelines. We're very concerned. We're all concerned. The first response from the CDC appeared to throw blame on the staff there, saying they didn't believe that protocols had been followed. And of course, we've seen this in Spain as well, but this is what American nurses had to say.
When the nurses become infected, they are blamed for not following the protocols. That is not going to work.
And of course, as it spread in Spain, they criticized healthcare workers, threw them under the bus, but they weren't having any of it. They threw their surgical gloves at the health officials who were criticizing them. Now, take a look at the local healthcare official, Judge Jenkins, who's really in charge of the response there in Dallas. Look at the difference in where he was about a week or so ago as he addressed people and told them about how he had gone into the apartment, he stayed with the people, he transported them, and he was at a press conference wearing the same shirt. Here's that clip from a week ago.
I'm wearing the same shirt I was when I was in the car with that family. If there were any risk, I would not expose myself or my family.
So that was about a week ago. Look at the difference in tone yesterday as he announced that it has spread.
The people that were self-monitoring, all of whom are healthcare professionals, will now be monitored twice daily by epidemiologists and interviewed today by CDC epidemiologist.
Now, what he eventually got around to saying was that 48 healthcare workers that they previously didn't consider to be a high enough risk to monitor, they are going to start monitoring them now. We also learned from the Telegraph that when the nurse went to the emergency room, she was waiting for 90 minutes before they put her in treatment. Now, the CDC chief is also changing his tone. He says that they now need to rethink how they're going to address infection control as the outbreak of the deadly virus has spread. They're going to have a new strategy, evidently. I wasn't aware that they had a strategy. Do they have any way that they're planning to contain this? Of course, there is no treatment for it. There's not any cure. All they can do is provide some medical care, and we're severely limited in that, but they're going to rethink this. I would like to know what their strategy is if they really, in fact, have one. We haven't even heard mistakes have been made. They haven't even got that far. We certainly haven't heard a coherent strategy. We've seen them issuing quarantine orders and then going into the apartment and then walking into a press conference afterwards. That's the kind of inconsistency that we've seen as it looks like they're trying to spread this. Now, the WHO is saying that Ebola is the modern era's worst health emergency. They say that economic disruptions can be curbed if people are adequately informed to prevent irrational moves to dodge infection. That's right. We don't want you trying to do anything that's going to harm the economy in order to save yourself from catching Ebola. See, their priorities are really the economy. It's really keeping continuity of government. They don't really care if the public comes down with a massive pandemic because, of course, population control has always been a goal. So they're looking at this, and we see from the World Bank, we also see from foreign policy that what they're really concerned about is not the public. The World Bank has said that 90% of economic costs of any outbreak, quote, come from irrational and disorganized efforts of the public to avoid infection. Yeah, that would be irrational to try to avoid infection. They say we're seeing right now how this virus can disrupt economies and societies around the world. Adequately educating the public, they say, was a good defense strategy and would allow governments to prevent economic disruptions. Well, they're not really trying to educate the public. They're basically giving us happy face news, a Pollyanna version of the Ebola outbreak. Take a look at what's happened just today. We had a flight come in today from the Emirates that has been quarantined at the Boston airport, Logan Airport. Apparently, 5 passengers on board on a flight from Dubai were experiencing flu-like symptoms. Crews are on the ground responding to the situation. And those passengers, however, were not in West Africa. Still, we have at least one emergency responder in hazmat gear that has boarded the flight. Now, it's important to remember, as it looks like maybe they're exercising more caution than is necessary, it's a good thing to try to quarantine people to stop this from getting out of control. I would rather see them err on the side of caution. We should remember that Ebola truly is an airborne virus. As Stefan Molyneux pointed out this weekend, it's airborne in airplanes. That's the way it was brought to Nigeria. And we should take a look at the Nigerian example to see how they got that under control. In this report from the LA Times on September 30th, they say that if no new cases occurred in Nigeria within 42 days, the outbreak would be over. That has been hit now. And so what they're saying is it's important for all countries to be vigilant because there's, quote, still ongoing transmission in the heavily affected countries, even after they don't see any new cases for 42 days. And of course, we've learned in the past that they're telling people not to have any sexual contact for up to 3 months. That's the CDC's figures. I've seen it ranging anywhere from 7 weeks to 7 months that they report that people are still shedding the virus in urine and sexual fluids. So they were very careful, however, in Nigeria. Look at this report from Euro Surveillance where they looked at how the Nigerian government got control of this. They say that all 20 cases stemmed from a single importation from a traveler returning from Liberia on the 20th of July this year. Now, of course, that was by airplane. They say he flew from Liberia to Lagos, Nigeria in a commercial airplane with a stopover in Togo. The case became symptomatic while flying, and he collapsed at the Lagos airport upon landing, which prompted him to seek medical attention and led to a number of people being exposed to Ebola. But now, this is the point. A total of 898 contacts were subsequently linked to this index case, including 351 primary and secondary contacts and 547 tertiary and higher order contacts. You understand? They quarantined 898 people because of this one person on a plane who collapsed. They still had 20 people come down with Ebola. What have we done in the United States? We've been days without doing anything in Dallas, and we've already seen one other person contract the virus. And taking us out to break, Joe Biggs is at the border looking at what's being done there to protect us from an outbreak of Ebola.
DNA Force.
When cells become toxic, they die early and aging sets in.
DNA Force.
No one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. Just one of the key compounds, BioPQQ, is backed by major clinical studies.
DNA Force.
We now have the synergistic solution. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139.
DNA Force.